Right then, how to mix my HCG with bacteriostatic water. So there's my water, and this is the stuff I'm using. Gonasi HP. Seems like the standard that we get in England, really, this, and it's 5,000 IU per 1 ml. So if I unbox this, I've got all sorts of rubbish in here. I think that's all for like female stuff. All I want is this here. There we are. See that white stuff at the bottom? That is the stuff I'm going to be mixing with the water. I haven't actually got any 2 ml syringes. I only get these. These are pretty good, these ones. They're 1 ml. RDS. They reduce dead space. See this? See that little plunger going out through the middle there? See, that pushes when it gets up to there. Look. Normally you lose all your testosterone or your HCG up in this bit, but that little plunger there gets most of it out. Pretty much all of it out. So like I said, I ain't got a 2 ml syringe, I just uses this. So I'm going to put 2 full ones of this in with the HCG. So here's the water. Oh, let me tell you something first. Clean it. Clean it with a pre-injection swab, if you can get it out. There we are. Okay, you're meant to let it dry. I think it takes between like 10 seconds and 15 seconds, but we'll just go straight in, alright? For the purpose of this video. Now this is a lot easier to go away cat, go away cat, go away cat. Don't you dare. There's a cat about to jump in the mirror. Don't you do that. So this is a lot easier to get out than testosterone, because obviously it's water. Get out of the way, cat. Sorry about that, my cat was about to jump in the way again. Full of animals, this place. So there we are, there's 1 ml ready to go. So, did you see that? That's what I talk about in other videos. See, there's a little gap at the top here now. I tried closing it down then, but with the pin on top. But when I do that, obviously you need to get rid of this area when you inject. And it's easier to take the pin off, because then you don't waste any HCG and you don't waste any testosterone. You just get it straight to the top without it squirting everywhere. Obviously, I'm only putting it in the vial, and when you put it in there, so it don't matter that much, but it's just good practice. So there's 1 ml ready to go. So get me HCG. That's brand new, but I'm still going to clean it anyway. Now with this, see the HCG there? I've been told not to squirt the water straight at it. Let it trickle down the side. Apparently it's quite easy to damage this, so just let it trickle down the side. Take it nice and slow. There we are. And it literally dissolves straight away. You'll notice in all my videos, I like to take everything really slow. It's just the best way. If you start rushing, that's when things go wrong. Or you end up getting PIP, post-injection pain. And it is one of the worst pains you'll experience if you get it wrong. Wow. Especially if you're injecting in your quad or your shoulder, that'll write you off. You ain't gonna be able to train that day, or probably the following 2 or 3 days. It is one of the worst pains you can have. So there's 1 ml of it in. I'm just going to repeat that process now. I'm going to get 1 more ml in there, so I end up with 2 ml. So let's go again. Coming out a bit better that time, and you'll find that as well. Sometimes it just flies out, and sometimes you struggle. In previous videos, I've done that thing where, like, obviously I'm pulling out 1 ml. So some people, I've done it myself. I put 1 ml of air in the syringe and I push the 1 ml into the vial, push it in, and then it should just suck it straight out like a vacuum. But there's not a problem, like I said, it's so easy doing all this anyway because it's literally water. So that's another one done. Put my 2nd ml in the HCG now. Same again, I know it's dissolved, but take it slow. So I'm going to be injecting this in a minute because I had my 0.2 ml of testosterone amphetamine yesterday, and I've been prescribed to do this the following day. 0.2 ml of this. So if you get the same stuff I do, and it's got all this stuff in it, just chuck it away. Chuck it away, because all you need is this. This is all you need. I've done another video about injecting HCG, so if you're waiting for that bit, you might as well go check it out on one of my other videos. So I do loads of stuff like this. I talk about my mental health as well. Subscribe if you're interested. Oh, and before I go, store this in the fridge. When it comes like this, it can be just stored at a, just cupboard temperature in a nice dark place without any direct sunlight. But as soon as you mix it, stick it in the fridge along with your bacteriostatic water. Store these in the fridge, otherwise they just won't do their job anymore. Cheers.